Hey everybody, I want to talk to y'all today about biotin because people are like flipping out about their hair and they think biotin is the answer to it. Well, the answer to not losing their hair, and it can possibly help depending on who you are, certain situations, or what else you're taking and everything, but it's not the end result, of like not losing your hair. So I just want to talk about biotin, what it does, and everything like that. What I know about it. I am not a scientist or anything, but I do know a lot about it. Um, Basically, biotin is just another B vitamin. It is also known as like vitamin H, but it is a water soluble B vitamin. So when you're taking B complex, if you're taking B complex vitamins, most B complex vitamins have biotin in them. Some multivitamins have it in them, and anything that you're taking that has like B12, like energy, like my fiber gummies have energy and metabolism builder in it, meaning they have like extra B vitamins basically. And so they have biotin in them as well. But I don't really take them anymore. Anyway, okay, so the purpose of biotin is it has many different purposes. Its main purpose is not to grow your hair. That's not the purpose of it actually at all. Um, so the main purpose of it is to assist with skin, nails, your digestive tract, cell growth, and metabolism. Notice I said nothing about hair because its specific purpose is not to grow your hair. It does help with cell growth, and anything that helps with cell growth, skin, and nails, your hair benefits from it too, because your hair, all that kind of interacts with each other, and the same things that causes your nails to grow, and like skin healing and cell regrowth will cause your hair to grow as well. But it is not a main cause of biotin, and it has not been proven by any administrative body that biotin causes hair growth. Okay, also, I want to say this. Notice I did not say that it stops hair loss. You're going to lose your hair regardless, because that is a side effect of your anesthesia, and because you're not getting the nutrients that your body is used to from when you were fat. You are changing your whole lifestyle, and regardless if you had surgery or not, you'll probably still lose more hair and have some shedding, because um, you're changing all the nutrients in your body. I don't know where that came from. I'm sleepy. Okay. I mean, I'm not sleepy. So anyway, yeah, that's the deal. It does not stop hair loss. Your hair still will fall out. So if you start biotin, let's say your surgery date is today. If you have surgery today and you start biotin, like whenever your doctor releases you to start vitamins, which is like between maybe 7 to 10 days or whatever. Let's say you start biotin and every other vitamin, whatever, next week, like on the 15th. Then you're still going to lose your hair. Biotin is going to help the new cells grow. So the new hair follicles grow, and the old ones are still going to fall out. And some of them that are dead might actually be pushed out faster with the biotin. So you're going to lose the hair anyway, but the biotin might help it be pushed out faster. So you might think you're losing more hair since you're taking the biotin, but the biotin is actually helping to regrow healthier cells, if that makes sense. And also, there was something else I wanted to say about that regrowth. I don't remember, but whatever. Oh, that's what I wanted to tell y'all. Don't think that the biotin is just gonna grow your hair from just the top of your head and that's it. No, ma'am. Some of y'all might get a mustache. Some of y'all might get those whisker thingies, especially if you had them before. No shade. Um, Your hair under your arms will grow faster, so you're gonna have to shave more. Um, your hair on your TT will grow faster. Hair on your legs if you have that, hair on your arms, hair everywhere. It's going to help hair grow. Period. So that means you're gonna have to shave more often, get waxed more often, or be hairy as fuck. And you're also probably gonna have to get your nails done more often. But a benefit of it is like if you cut yourself or something, you have a scab, you'll see it like heal a little bit faster because of the cell regrowth or whatever. And it does help with digestion too, so you'll be able to process things better. And if you have diabetes, it is known to help insulin levels and blood sugar as well too. That hasn't been proven, but it is scientifically studied or whatever. So how do you take this shit? Because people think the more biotin you take, the less hair is gonna fall out. Y'all wrong, and that's stupid. Just saying. The average amount for a woman that is 19 years of age or older is about 30 micrograms. That's the MCG, 30 micrograms per day. So that means it's usually like 2 supplements if you're taking. I usually take about 5,000 grams a day maximum. um that's sufficient. Taking 20,000 no, not grams, milligrams. Say grams. Taking 20,000 milligrams is not going to help your hair growth. It's not. Also, I want to say starting it right after surgery is not, you're not going to see effects, because it's not going to affect the hair that's on your hair right now. It's going to affect the hair that is going to grow in a month or two, or however your hair cycle goes. So what I always recommend is like I started taking it about 4 months before surgery, about 3.5 to 4 months before surgery. Start before surgery, so that when that hair does fall out, when you get your anesthesia and everything, you'll have that biotin already in your body, and it'll be, processing it. Your body will be processing it, because your body does recycle biotin. It is natural in your body, and your body does recycle it when it needs it, and it produces it and it recycles it. Also, you don't have to take supplements to have biotin. That's why you do not have to take it, because biotin is also found naturally in foods, because it is a vitamin. Some foods that we tend to eat as weight loss surgery people, that have more biotin in it: eggs, many dairy products that we eat, salmon, and chicken. It can also be found in like whole wheat breads and stuff like that. But we don't eat bread, right? Well, I don't. Anyway, there are different types of biotin as well. I know people have heard sublingual biotin. They're like, oh, that must be better. No, the different sublingual biotin and regular biotin is, the only difference is sublingual means it's like a word that comes from the Latin word that means under the tongue. So sublingual is where you just put it under your tongue and it dissolves into your bloodstream that way. That's the only difference between that and swallowing the pill. I would say this sublingual biotin gets in your bloodstream maybe a little bit faster, because it doesn't have to dissolve in your tummy or whatever. But that's it. And if you haven't watched my vitamin video, you're probably I'm gonna get an inbox saying, well, what kind do you take? I take gummy. I take gummy. I don't have it with me, but it's like a gummy biotin. It's not really biotin, but it is biotin, but it's called gummy hair, skin, and nail vitamins, or whatever the name of it is. And it has a lot of biotin in it. Oh, excuse me. It has other stuff in it too. It has other vitamins in it as well. And it's almost like a B complex with mostly, instead of having mostly B12 and B6 in it, it has mostly biotin in it. And I take that. The recommended dosage is 2 a day, but because it's gummy, I take 4 a day. And I do that because if you haven't watched my other video about vitamins, with gummy vitamins, Your body, because it's a gummy, your body does not absorb all of the nutrients that a gummy possesses. So that recommended dose, if I was to only take two, I would probably be deficient in most things. I am not deficient in everything according to my labs and according to my doctor, but I double every vitamin that I take because I take all gummies. And they good. I love gummies. They're so good. So that's what I do. And I'm gonna repeat this again because people think biotin is like the end all be all to losing your hair. Some of y'all just don't have no hair. And not taking or taking biotin is not going to help it. I had really, really, really thick hair, and I still do have really, really, really thick hair, but I did see a decrease in the amount of hair that I had. It got a little thinner, and that was because of anesthesia, and I knew that regardless was gonna happen. So I started my biotin like 4 months in advance, and I prepared for hair loss, and I'm not tripping. Like, I put a sew-in in. My hair has been growing fine, but you have to take care of your hair too. I have another video that says take care of your damn hair. And that's because some of y'all expect biotin to do something. Well, guess what? If your hair is brittle, it's cracking, and it's dry, and it's damaged, your hair is not going to grow because of biotin. Like, you have to take care of your hair regardless. And if you're bald-headed, or if you have a couple of strands of hair, you just got thin hair, baby girl. That's it. Like, don't trip. Go buy some hair. That's all you got to do. You're not going to. Biotin is not going to be a miracle drug to make your hair grow. It's not. You have to, if you want significant hair growth, you have to follow a regimen that is good for your hair and that gives your hair exactly what it needs. You have to learn your hair just like we had to learn our bodies with this whole weight loss journey. So if you are really looking to grow your hair, you need to start a hair journey and get to know your hair and take care of it. Biotin is not going to do that for you. It is not a miracle drug. It is just a B vitamin that will help you develop cell regrowth. That is it. I am done preaching. All right, guys. Bye. Have a good weekend.